Hi everyone. We're going to just discuss the health and medicine, focus on that with respect to radioisotopes. First, we're going to look at diagnosis and then therapeutic uses for these. So, this video could be 2 hours long discussing all this. And so, in a traditional class, we have excuse me, lots of discussion about all this, the benefits, the pros and cons to using radioactive isotopes in health and medicine. And so, first, I just want to start by saying that what I mentioned already, but that we can use radioactive isotopes both in diagnostic and therapeutic procedures. So, in a diagnostic test, you're going to measure the function of an organ or locate a tumor. Okay, and we use low doses of radioactivity to do this. When radioactive isotopes are used for therapeutic reasons or to try to, get rid of the tumor, then you have to use higher doses of radiation. And so this is often why cancer, when you try to kill these cancer cells or diseases, that there are side effects, right? Hair loss and nausea and things like that. So you can take a radioactive isotope. An example, technetium 99. It's used to evaluate the gallbladder and the bile ducts and detect internal bleeding. Another example, thallium 201. Iodine 131 is also an example. And so these are used to scan normal organs, and if your organs are functioning normal and everything is all healthy, then you see clear, visible organs. And if you have a tumor or something, it's not going to uptake these isotopes, and so you would see them. These sort of holes are not clear, bright spots on a scan. So if you look here, this would be a healthy scan. Okay, and so here's just the organs that we're looking at, and see how they light up brightly here. If you had a tumor or something that was not healthy here, then there would be places where you would not have the bright spots that would come through. Okay, and so the organs uptake the isotope, and then of course the half-life of these isotopes is not very long. Therefore, it gets the scan, and then your body gets rid of the isotope. Okay, so this would be for diagnosis, to look at your organs, but you can also use radioisotopes for treatment. Okay, and so for instance, iodine 131 is used to irradiate the thyroid and help with hyperthyroidism. The list can go on and on. Phosphorus 32 is used for treating leukemia. Iridium 192 used for treating breast cancer. Okay, and so these are higher energy radiations. They're higher in energy, and they can be used to kill those rapidly dividing tumor cells. Cobalt 60 is another radioactive isotope also. These have longer half-lives. So cobalt 60 is about 5.25 years, and they can also lead to, like I mentioned earlier, radiation sickness, including vomiting, fatigue, and hair loss. Okay, so there are cons to using these, but there's also pros. And so a lot of research now is out to look for ways to seed or wire these radioactive isotopes to only target the tumor cells. Okay, and so if they could just kill those and not kill the healthy cells, then that would be huge, right? So we can also use PET scans. They fall in this category, positron emission tomography. And these scans emit positrons. So they scan the organ and they emit positrons. And they can be used to detect tumors, artery disease, Alzheimer's, and they can also track the progress of cancer. So a cancer patient, you could look at one scan, and then after some treatment, radiation, you can compare it to another scan. and it's a non-invasive method of monitoring cancer treatment. And so what happens here is it's different from what we saw earlier, in that what shows up is the cancer. So if you look here, it's a different type of scan than what we looked at a few minutes ago. Okay, all of this dark area, this is cancer. Okay, and so in this scan, it doesn't show the healthy organs. Okay, it shows areas where there are tumors or the potential disease or problems. And so after some treatment, so if you compare this scan and this one, okay, you see that there's been a lot of progress in removal of the tumors and the cancer cells. Okay, and this here is just concentration of the isotope that's in the bladder that is just high concentration that's going to be eliminated, right, in urine. So, but you can see the difference between these two. There's been a drastic improvement in the cancer. So the PET scan shows areas of problem. It shows the areas where there is tumors or unhealthy cells. All right, I hope this helps, and I hope you're starting to see, you may even be more interested and want to read more about these scans. These are very interesting. So radioisotopes are very important, can be very, very useful, but of course, because of their half-lives and because they emit these particles that penetrate our skin and can penetrate our tissues, we also have to be careful with them. So it takes a lot of time and a lot of research to figure out what can work best on humans. All right, thank you.